Welcome back to the conversation. My next guest is a reporter with The Guardian. She worked on the series called Guns and Lies in America and has done some recent reporting on how coronavirus has impacted the incarcerated community in California. Please welcome Abene Clayton. Abene, thanks so much for being here. You have written this article about COVID and its spread in prisons in California. So you write that 8,000 California inmates have tested positive for coronavirus. 49 have died. Can you just explain beyond the numbers what the situation is like?
So from conversations that I've had with people who are currently incarcerated, folks who have gotten out early through these COVID population density relief efforts, as well as advocates, it's really, bungled is probably not even the best word to use here, but it's just really confusing, lots of moving pieces. This is of course, unprecedented situation, but from what I've heard, people's rehabilitation, the programs that they were a part of have completely stopped. The people are on lockdown. Earlier in my reporting, I was hearing from folks who were scared to even reveal that they were having coronavirus symptoms because they knew that they would be moved. And some people had cellmates who tested positive while they were negative, and they were just kept together because there simply was no space for the first month and a half, 2 months of coronavirus entering the institutions where it's concentrated. And they built a tent city in San Quentin to try to help that situation and people, but it hasn't done much in terms of the emotional toll and not being able to talk to your friends and stay in touch with loved ones. And I even talked to some families who just couldn't get in contact and couldn't get any medical information and were finding out really piecemeal through, contraband cell phones and things of that nature. It's just been a really, really difficult situation for all the stakeholders, of course, most difficult for the folks who are incarcerated throughout California.
Absolutely. It's incredibly scary. And so how was it to get the information? Like if family members are having a hard time getting proper information about their loved ones, what about yourself? Do you feel like there's been a damage control sort of PR machine that's at work here to try and conceal some of what's going on in terms of coronavirus's spread in the prison system?
I definitely think the spin machine is running. There's no way really for the CDCR to not look quite shabby in this situation. I have been relatively fortunate in having good relationships with different local advocates and formerly incarcerated people. I volunteered at San Quentin when I was in grad school doing the newspaper. So there were just different connections that I was able to foster as a reporter. And people trusted me to share, my contact with the folks who are inside. And honestly, just posting occasionally to Facebook or just saying, does anyone have a family member? And I got loads of really, really scared mothers and wives who reached out just to be heard. So
wow.
In terms of reaching stakeholders out here who are in the free world, it's been exceptionally amazing just to see how many people are so willing to talk to reporters. When it comes to reaching out to prison officials, of course, the story is quite different. There's a main spokeswoman who the bare basics of information she will give, most things end up being confidential and or will be directed back to the website. So there's not a lot of content there. I've mostly been relying on memos and things of that nature to try to piece things together. But if there's something that needs to be confirmed and I need to reach out to the CDCR for contact for confirmation and things of that nature, I do it as a part of my due diligence. But it's hard to get really straight answers that address the concerns that I hear. So it's been mostly.
Right. Yeah, you also write that not only family members are concerned, inmates are concerned because they can't socially distance from one another, but there are shortages of basic things like soap and other, cleaning supplies. Can you talk a little bit about that?
Yeah, when I was hearing from people, especially those who are in these more congregate dormitory style settings, there was just a real struggle to get good soap. They had to do the whole dilute it with water to make it stretch, getting one mask to try to make it last for a few days. And people weren't having access to showers, but maybe 3 times a week, making their own sort of Lysol, because certain things just count as contraband. You can't have in prison, you can't have the same kind of hand sanitizer and Windex and the things we rely on out here. It's illegal in there, and there are shortages among people who are incarcerated as well as the staff, which we heard about during a really illuminating Senate hearing about a month ago.
Right, because when outbreaks happen in prisons, it's not just obviously within the walls of prisons, but outside, right? So like, what is the impact on communities when there's been an outbreak in San Quentin, for example?
Yeah, so San Quentin is a bit of a kind of different situation, if you look at the whole scope of the CDCR. It's in a very, it is of course a prison, so it's not going to be the Shangri-La or anything, but it is in a very resource-rich area. You're in the San Francisco Bay Area. You have the prison itself has kind of become a beacon of rehabilitation. A lot of people are looking at it. Doctors, medical professionals. It's in right across the bridge from UCSF Medical Center and all of these amazing research institutions. But if you look at a place like Avenal and some of the other prisons that are in the more rural parts of California, where hospital resources are already slim and these prisons are a primary employer, that's where you really start to see just how dangerous a coronavirus outbreak can be for such a small town. And you really realize how it's illuminating issues in healthcare and shortages that existed long before coronavirus came onto the scene. And I think that's really where a lot of the danger is to the surrounding communities in those rural places that are already struggling along.
Right, places that had health deserts, if you will, doctor shortages already. Now that the coronavirus is arguably coming back home because of people who work in those prisons, they're grappling now with that health crisis. It's not contained. I mean, it's a pretty morbid reminder of just how many people are incarcerated, right? But now you realize you can't just lock away your problems. Hey, what do you know? Maybe prisons aren't the solution.
Think of safety. It really it puts it in a different frame. Like, what does actually keep us safe? Is it locking away people and having institutions that are over 120% filled, or is it finding alternatives that can heal, restore, et cetera, et cetera? And those investments have been a long time coming, and I don't know if this current situation will show just how high the stakes are. Because, like you mentioned, there are people who are coming home who work in prisons, and that's how it got in there in the first place. And now they're bringing it to their families, and it's a really unfortunate situation in the state.
So Governor Newsom obviously has been praised because he's better than Trump, which is just such a low bar. I don't think it deserves praise, but what has been the governor's response? And I know there is a promise to decarcerate or depopulate some of the prisons, as you mentioned, that are already over capacity, right? They're completely overcrowded. What's the state now? Like, what moment are we in? And do you think that this gets better?
Well, I will say that for the first couple months of reporting on coronavirus, Newsom has these, they're called like Newsoms at noons. I don't know if that's the official name, but that's what we kind of call them in the newsroom, Newsom at noon. And he was surprisingly, for a lot of stakeholders, quiet about the outbreak, even as it grew and even as the reporting was showing, okay, cases are going up exponentially, you know what I'm saying, to the third and fourth power here. He was quiet until about maybe a month or so ago when some reporters pressed him on it. And you're right, there have been some efforts to decarcerate. They announced 3 new initiatives. One is a credit earning initiative, and then there are some early reviews of cases for folks who would be out within, maybe 6 months to a year, and that's said to have an effect on anywhere from like 8,000 to 17,000 people.
Oh,
but
wow.
In terms of does it get better, I'm not sure, just because of the, from what I have seen, the violent, non-violent offender dichotomy. It's just politically unpalatable to say we're gonna release lifers regardless of whether or not they're 70 and have been behind bars since they were 19. And that is really where a lot of people want to focus efforts, not necessarily on the younger people who are about to be out anyway, but more so on those folks who may have a very serious felony that they're serving time for, but are the most vulnerable to get and die from coronavirus. I don't know if he's ready to make that move. So yeah.
Right. That's a really, really important point. Absolutely, that it's the more at-risk populations who might, be serving longer sentences for more serious crimes, which is a different conversation. Meanwhile, Roger Stone apparently can't serve any time for his crimes because he is elderly. He's 60 something? The same age as probably many of the people who are currently incarcerated and are suffering from coronavirus. Anyway, Abene Clayton, journalist with The Guardian, thank you so much for this reporting and for the interview. Make sure to check out her work and stay safe.
Thank you so much. Same to you. Thank you for having me. This was great.
On the go? Don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcasts.